Welcome to this episode of GLI Live. I'm your host, Donna Cryer, the founder and CEO of the Global Liver Institute, and I have the honor of bringing to you today COVID-19 on the front lines. And our guest today is very special. She has been on every front line that there is in this fight against COVID-19 and this global pandemic. So as those of you who have joined us before, GLI Live is part of the Global Liver Institute's response program for COVID-19. And although first constructed for liver patients and those of us immunocompromised, we recognized and are very honored and humbled that this information has found to resonate with everybody who needs just a little more information and a little more connection during this time. I also want to thank all of our sponsors for this program that allows us to keep this up and running and bringing this information to you. So today I have Dr. Tsion Firew. She is an emergency department physician. She is an assistant professor at Columbia. She's also been affected by COVID herself. She is a COVID survivor. If that's not enough for you to want to listen to what she has to say today, she's also served on the front lines in Iraq and is coming to us today from Ethiopia, where she is a special advisor to the health ministry for Ethiopia. And so welcome, Dr. Firew, and thank you.
Thank you so much for having me here, Donna.
So let's start to unpack all of these valid experiences. So what is it like in the emergency room, in the emergency departments, dealing with patients who are coming in, trying to figure out if they have COVID or they know they're infected? We've heard so many ER departments have just been overwhelmed, lacking PPE, and just stressing staff and health systems to the max. So tell us what your experience has been.
So, back in March and April in New York, it was very surreal. Like, it was just, I've described it that, it felt like just a COVID-19 bomb hit in the city. The city became, deserted, and all of a sudden, our hospitals were filled with patients that, had COVID-like symptoms at that point. And early March, we didn't even know that we were treating COVID patients, but we were. I myself, had an exposure first. A patient that came for a completely unrelated symptom had a positive COVID test. So, the numbers just overnight exponentially grew, and our hallways were filled with patients that had cough, fever, fatigue, all sorts of symptoms, shortness of breath, cough. And then once the disease made its way into the nursing home, then we saw severely ill patients arriving. Even when our hospital capacity, our emergency department capacity, initially the emergency department was the hardest hit. Once the critically ill patients start coming, then the patients start, our ICUs and start getting admitted. But mostly the patients would have, simple symptoms, and we'll just discharge them before we knew it. But before we enabled our surge capacity, our hallways were filled with patients that were coughing, that had all sorts of illness, and most of our regular beds had patients that were on a ventilator. It felt like you were rounding the intensive care unit because you would hear the monitors and the ventilators beeping nonstop. And it was just, very overwhelming, and it was nonstop. The second you're like, okay, I have to go to the bathroom, and you get a notification saying you have a patient that's arriving in 2 minutes for shortness of breath. And as you know, our paramedics were overwhelmed. They actually received the highest number of calls in New York City since 9/11, and it just everybody felt so stretched beyond our limit. And simultaneously, we were also, losing our colleagues to COVID, either they died, or because when you had the symptoms, you had to stay home. So we were also, facing a double burden with the shortage of staff and also the overwhelmed of patients. Help arrived finally, right? People from all over states started coming to help, but it came just a bit too late. And I was really hoping, well, we were all hoping in New York that this would just be it, that we will be able to put out the fire in Northeast, and the rest of the country will learn from us. And we were unprepared from federal level all the way to the city level. It was not getting the necessary attention that the WHO had warned us about starting from back January. So we paid the price early. It was so overwhelming. And then at the same time, most of the patients that we see, like even our transplant patients, our heart attack patients, our stroke patients, they were never coming to our emergency department. So we're wondering, where are they? Are they dying at home?
Because all of those conditions didn't stop just because of COVID. There were these diseases, like many liver diseases are already at epidemic levels, and people didn't start having heart attacks. They just stopped feeling comfortable or safe coming into the emergency department, fear of COVID. And I think we're still having that problem now, isn't it true? Even though many health systems are reopening and have redesigned for non-COVID care as well as COVID care. But we need to get that message out to people, to patients with other diseases, that they need to get their appointments by telehealth, or their lab work done, or just ask the questions about how care is being delivered safely, and go into the emergency room, or where their health system is designating for them, or go to your doctor's office and get the care that you need, so that we don't have this other wave of patients just crashing from preventable illnesses, or illnesses that had been stable that have become unstable because people weren't getting the care that they needed. That's a huge concern of me, and I know many in many different disease states are
absolutely. And we already seen that in New York, because a lot of patients that had waited not to come until the pandemic had subsided in places like New York, we're seeing a late complications. I always tell the story about, early June, a patient that I saw had lesion on her breast starting from back in March, but she didn't seek care. And by the time she came to our emergency department in June, the cancer unfortunately had metastasized to her brain, to her spine, and to her lungs, and a young, in her 40s. So, and it was just a fungating mass out of her breast, but she just waited out of the fear of coming to the hospital. So not only are we seeing a complication of, chronic diseases, but also other life-threatening progress of like diseases like cancer.
Let's go back to something that you mentioned about your coworkers contracting COVID. You yourself contracted COVID. I'm so grateful that you're here with us today. So tell us about that experience, and then also what they tell you about the long-term effects of having the coronavirus, of this coronavirus.
Yeah. So I had my symptoms very early in September, when we did not know much about the disease. So more than the physical symptoms, I was more, the psychological and the mental toll was more overwhelming, like what's going to happen to me. Some people just attributed this, it's just going to be very severe on old patients. But no, because I was declaring young people dead in our emergency department. So right about when I got sick, there was another physician from another hospital that we found out, who was around my age, that also died from the disease. So I was really worried that, I might also succumb to the disease, but at the same time, making real expectations. Like, I wrote down my life insurance for my family if something happens to me. I tried to rest, for me, my symptoms weren't so severe, like severe shortness of breath or hypoxia or low oxygen level. But it was more like the headache, the fever, the fatigue. I'm usually energetic and all around, but I slept for straight 4 days. Wow. And it was very exhausting. is just, completely drained me of energy. And also I unfortunately also infected my husband, who was taking care of me at the time, as far, as much precautions we took. And also I know it's really going to be bad on, on men and people of color. And then also, of course, my concern is it going to be okay? So, and also, a couple of other physicians, nurses had in our emergency department, and some unfortunately died. Also one who's made the headlines, my colleague, Dr. Lorna Breen, had died also by suicide. So, it's not only the physical, but also the mental consequence of that we really have to be vigilant about. And simultaneously, we don't know the true numbers. I'm actually doing this other study where we look at, how many healthcare professionals have gotten infected. It was a survey that we did. Over 3,000 healthcare professionals accessed the survey, and we had a complete of 2,000 responders. Out of the 2,000 healthcare workers that responded, almost 30% had been infected. So, and a lot of, unfortunately, the CDC and a lot of the other healthcare environments haven't revealed these numbers, and specifically the numbers that have died. And there are people working on that who are trying to get the real numbers. But, we all remain a threat, especially early on when we didn't have enough PPE. And now, unfortunately, as the numbers are skyrocketing in the US, it's the same true story all over. And also testing. I didn't have testing. I couldn't get tested. That was another frustrating issue to the whole thing. It was more symptomatic, but I had to finally, like 5 days later, most of the hospitals in New York didn't do it, but there were some places that were offering it. But trying to navigate that, I felt so defeated. I felt so unappreciated.
And you're on the inside of that. And so for patients are outside of the system, it's even more difficult. But I want to touch on, you spoke about, the wonderful generosity of healthcare workers from other states who are now hotspots, who came to New York to help out. And hope that they would learn the lessons of New York, so that things wouldn't progress and get out of control in other states. But that hasn't happened. So what lessons would you have liked for them to learn in these other states? And what can people be doing, whether it's government officials or individuals, to make sure that our health systems don't continue to be overwhelmed or aren't overwhelmed again?
So I think at this point, we have to make this a priority as not, of course, for healthcare professionals, so we have, they don't have any options, but really everyone, this is part of our life for unforeseeable future. And then healthcare, we all have to support healthcare workers. We have to believe in the science. Right now, what really works is the prevention. So that's the only thing that we know so far. Really stay away from, conspiracy theorists, and really try to listen to the scientists and healthcare professionals. And of course, government officials, unfortunately, there is always a battle of the economy versus public health. I think if
and is it really a battle? Should it be a battle? Because you can't have a healthy economy if you don't have healthy people to do the work or buy the products. They really go hand in hand and shouldn't be set at odds, don't you think?
Absolutely. You said it perfectly. And I think, you have to invest in public health, so in that way you can have, a good economy. And at the same time, believe in the science, make masks a mandate, make science part of your decision. And unfortunately, we're seeing some health commissioners who are not being supported, who were for masks, or who are really trying to make the science part of the decision. And we've seen it, health commissioners resigning because of this disagreement between mayors, city officials. So really, I think it's important that city officials and mayors listen to healthcare professionals that know the science and the evidence. Yes, and governors, governors, president, all of that. Yeah, so I think it's important, and simultaneously, this I think is very important that we do not politicize this pandemic. Unfortunately, that's what has happened in some countries, especially places with populist leaders like Brazil, US, Russia. It's important that we don't politicize it. We've learned, we've seen this. People, places, countries that have taken, you know, drastic measures very early, they were able to avert death. And we're learning so much about the disease. We don't know what's going to happen, what the long-term complications are going to be. So it's very important.
You know, it seems to me that there's a common thread between those countries who've done particularly well in combating COVID-19 and are able now to reopen businesses and schools. And maybe I'm wrong, but it seems to me that many of them are led by women. Is there something to leadership by women that you know, we could also learn lessons from, you know, as we try to come to a new normal, a workable solution?
Yeah, I absolutely agree. We've seen articles that have made those arguments that countries that are led by women, you know, Belgium, Germany, New Zealand, they were able to avert, well, you know, they were able to bend the curve way earlier than most other places. And they took this collaborative approach. Like this, it wasn't like there was science, except as far as I know, except for, you know, for the German chancellor, everybody was, you know, not a scientist. So she's even herself, she's not in the health sciences, but as the physicist, I think she knows how science works. But most of them are most likely to make decisions based on this collaborative effort and evidence, listening, letting, you know, setting aside egos. I think that has all worked well. And, you know, there might be a confounding bias that they also had a good healthcare system. The fact that they elected a woman president or prime minister tells you something about the country, right? But in addition to that, once they put those people in power, they support them, they listen to them. So when the president, the prime ministers of those countries go and say, we know what works, so we should really implement this, the country or the people are most likely going to listen. And unfortunately, taking that back to what's happening in the US, we see health commissioners in LA and the LA County Health Commissioner, the Ohio State Health Commissioner, and what has also happened in New York City Health Commissioner, all women who have been preaching and really trying to implement the most updated scientific evidence when it came to masks. They've actually, unfortunately, had been threatened and they had to resign. So and they were all replaced by male commissioner. That tells you, right, when women and when general scientists take, when they, you know, err on the side of caution and are really trying to teach the most appropriate science and the evidence-based medicine, they're being attacked. So I think it's important that as a citizen that we listen to our healthcare professionals with the most evidence. They're trying to help you, they're trying to save you, they're not trying to politicize these things, unfortunately, which is happening in the States.
You know, one of the Global Liver Institute interns asked the question about, you know, what advice would I give to someone going into a career in public health? And so first of all, I said, you know, thank you for doing that. You know, we can't have our country, our economies, our you know, our lives without, you know, people who are willing and now, you know, not only smart enough, but brave enough now, we've realized, to go into public health and to stick it out. And I think that, you know, what I told this person was that, you have to realize that, as we've seen, that you're going to have to fight for it. You're going to have to fight not only for the, you know, doing the science well, building that evidence base and that scientific integrity, but you're going to have to fight to get that message across and to prepare yourself to be able to, you know, explain science in ways that non-scientists can understand. and then you're going to have to, persist in this, and you're also going to have to fight for funding for public health because it has been so underfunded, and some other priorities that sometimes are a little more tangible and a little easier for people to understand, like like education funding, for example. But we realize now is predicated on a basis of good public health as well. And so, that was my advice, that, be prepared to have to fight for it, and not only to be smart enough, to be, courageous enough and brave enough and persistent enough, for this career, but that, it's worth it, and that, we're all betting on them, because literally
Absolutely.
our lives depend on it. So this attack on public health officials, hopefully the outcome will be, all of us who stand up in defense of public health and public health officials in a way that we haven't perhaps shown up for public health before. I think we've always, particularly in the United States, just assumed that, the water was going to be clean, and and vaccinations would be available, and that there was this sort of deus ex machina, that it was just something that just happened. But it's not assured. It's not inevitable. We have to really be thoughtful and and fight for it.
Absolutely. I think you gave it the best advice.
Thank you. So you talked about masks. I also want to raise the point about part of that confidence in science is the fact that science evolves. And so we were talking about masks and some of these preventive efforts, hand washing and isolation and social distancing, in one way, in the spring, and we've learned so much more. And so, tell us how your own thinking and information has evolved with the science evolving.
Yeah. So, I look back what I said in March of giving talks, and I specifically remember saying, unless you have symptoms, there's no reason to wear masks. And over time, we've seen that with the pandemic and the course, and when the cases were growing, and at the height of the pandemic, you just have to assume that everybody has it. And initially, we were all saying that asymptomatic patients they're not at a risk of infecting others. But then over time, we learned that actually asymptomatic patients do infect others. So we said maybe universal masking is important. As this is a novel virus, we're learning as we go through it. And it's been around 7 months now, but in the US since March, now on our 5th month. And also, with geography, when you're putting this virus and exposing it to a population that has different socioeconomic status, it's going to have a very different outcome. So it's very important to be open-minded. I think it's important that we look for the evidence from the right source and from places that are not politicized. Unfortunately, initially I used to say, I don't want to get anything from the CDC at this point. I don't want to get any evidence from the CDC. Unfortunately, they have really messed up their reputation, and really was relying on WHO's data at that point that was giving very reliable data and evidences from all over the country. So and there are some trials that we can look at, what we call random controlled trials, and simple observations. One thing that we learned in public health is correlation does not mean causation. Right. So it's very important that we put that into practice, because it's you always have to make sure and research that the observation that you see didn't happen by chance, and you have to look at it from multiple different angles. So it's really about being versatile, and it's important to stay open-minded and look at the most recent evidence and guidance that comes from trusted sources. So staying open and staying teachable is what's important. That's gotten me through my medical career, and I think that's something that I think everybody should listen from and take that advice globally.
I think that's so important. And one thing that I've come to realize, as people are struggling with this information and how to digest it, and they say, well, I go to what they believe are reliable sources, but unless there is a foundation of understanding how science works, about what is or how you conduct a high quality clinical trial, what different study designs matter, the difference, as you pointed out, between an observation study and a randomized controlled study. You aren't able to interpret the information and judge for yourself whether these sources are reliable. And so I think that this creates an opportunity, hopefully, that many people will take to educate themselves about how science works, how clinical research works in different settings. There's great value in real world evidence, but there's also a different value in in these observational, in these randomized controlled studies, knowing sample size, how many people are being studied, the characteristics of those people in the studies. Certainly, as we look toward the vaccine trials, one of the things that I've been looking towards are, do they include diverse populations? Do they include people who've had, cancer or transplants, or, modulated immune systems, who are often, kept out of normal trials? So that I understand at the end of the day, hopefully when a vaccine becomes available, is it right for, for someone like me? So I think, that we hope, people learn more about the science and clinical research process, so that they can have more confidence in it, and more trust, and engagement with it.
Absolutely. And it's important, for the sake of the people that may not be able to get the vaccine, that others get it. So now we can get herd immunity. This is really about, the most, the healthiest, or the ones who do not have any comorbidities. Important for them to, seek the right information, and also hopefully get this vaccine when it becomes available, so we can protect people that have immune modulator issues and are taking a lot of medications that could suppress the immune system.
So what, you've shared so much with us today, and I thank you. So what would you most like our viewers to take away? You speak from physician communities and academic communities, veteran communities, public health officials in the U.S. and in Africa. What can we all do to support the great work that you're doing on our behalf?
Okay, so I think we touched on most things. Just the general thing, I do hope this is a wake-up call for everyone, that it's important to invest in healthcare system. It's very important to stay informed. It's important to remain cautious about things and really support one another. When we say that, solidarity is what would help us beat this pandemic. It's not just a cheesy thing. This is just, think of it like a World War III against humanity. So it's important that we work as a nation, as the citizens of the world, support one another. And this disease is going to remain a threat to everyone until it's completely eradicated from everywhere. And it's important that we continue to advocate for better healthcare systems, and it's not about politics. We've seen countries that have a better healthcare system tackle the disease much better, and it's important. So support your healthcare professional. Look out for one another, and also really look into the science when looking for good evidence, and stay away from people that say it's a hoax, or from the conspiracy theorists. So that was my message for everyone. And thank you.
I think those are such important messages, to invest in our public healthcare system, and to invest and support our public health and our healthcare professionals. So Dr. Firew, I thank you again for joining us.
Thank you. I appreciate it. Thanks for having me.
Thank you. And thank you to everyone who has watched today or at some point in the future. Please join us next week on Facebook, on the globalliver.org website, on our YouTube channel, or on Instagram. Please send us your comments, your concerns, but most of all, stay safe, stay well, and stay connected. And until next time, thank you.